Good morning, everyone. My name is Mary Vang, as you guys just heard my bio. I'm very nervous for some reason. I do a lot of public speaking, but I was telling my daughter who came with me this morning, I said, I don't know, I think when I speak in front of my colleagues and people who care about the work that we do, I become really nervous. And I think about how when I was a teenager, as a young child, I was one of those anxious kids who was selectively mute, right? I barely spoke in school. I was always very shy and timid. And to be standing in front of my colleagues and to speaking with you all today is such an honor. And so I'm just very thankful and grateful that Change has invited me and other colleagues like Dr. Kelvin and Shane to be here to speak about mental health in the Hmong community. And so today, I'll be not speaking by myself. I've also invited two researchers, Austin Tao and Bao, if you guys could stand up. When I was asked to speak about mental health in Hmong youth, I also wanted to really touch and acknowledge the suicide part of it. And so Austin and Bao has been doing some research about some current mental health research regarding suicide in the community. And we're going to be looking at identifying common mental health challenges experienced by Hmong adolescents and teens, including anxiety, trauma, and identity-related stressors. And we will review how cultural values, family dynamics, and historical context influences the mental health problems in our community, and recognize barriers to mental health access for youth, including language, stigma, generational gaps, and then we're going to talk and look at the research around identifying protective factors to lifetime suicidal ideations. So that's kind of the agenda for my presentation. And so before we start, I kind of want you to talk with the people at your table for a couple minutes and rate yourself about how knowledgeable you feel about mental health issues in Hmong youth. And so let's take about 3 minutes to do that and talk amongst your tables. You guys also learned a little bit about each other and the work that you do, and so we will have more time today to connect, it sounds like, amongst the schedule. And so thank you for Change and in providing that space for us. And so before we get started, I think this is mostly for me. I always like to start with breath work. As a therapist, I didn't even introduce myself. I'm a clinical supervisor for the Wilder Foundation in St. Paul, Minnesota. I've been practicing clinical social work for 20 years, and specifically, I started a program called Khue, which is a school-based mental health program that serves specifically Hmong students in the St. Paul Public Schools. So I've been doing that for about 15 years. I started that in 2010 with one school. And when I started that school, it was really interesting because I started at Jackson Elementary, which was 75% Hmong kids. And so I was invited to start the program because they saw that there was a need for mental health services for Hmong youth, but they had a hard time identifying and talking with parents about Hmong mental health. And so started that about 15 years ago, going on 16 years. And so I'm very thankful for the work that we do. We are now serving in 7 schools in St. Paul. And we continue to get requests from different schools within the Minnesota area just wanting to learn more about ways to serve Hmong students and how they could receive the program in their schools. And so very proud of the work that we've been doing there. And so before we get started, I would like for us to do some breath work. And so if everyone could just put their hands on their head and just take one couple deep breaths, okay? 1, 2, 3. Slowly let it out. Another deep breath. And out. last breath. Deep breath out. I like to ground myself before I do any work, and so I also brought a couple resources that I use. And so this book is called I Am Safe, Trauma Responsive Practices in Mental Health. And this is a book written by one of my friends, Chrissy Manoa, and she really talks about strategies to help support children and families in the work that they do. She actually received a lot of this information from a day treatment program that she worked in at Children's Hospital in St. Paul. Not only that, but she has a partner named Kathy Flaminio, and she is with Mood Mindfully. And we have inner resource card decks here, and I will introduce you guys to that at the very end of our presentation. These are just cards that I use in therapy with my kids, my clients and parents. It's been very powerful. It's work that we can do to help them acknowledge all the resources that we have inside of ourselves. And so if you guys would like to know more about it, I can give you those resources later too. So some of the demographics of the Hmong in America, and I know that all of us, most of us in this room are Hmong, and so we understand kind of the population, some of the issues that we are going through, but I just want to review this just to kind of see the gradual changes that have that we have seen in the Hmong in America in the past 50 years. And so right now we have about 330,000 Hmong people living just here in the United States. And this was Pew Research that came out in 2023. And it says here, 330,000 people in the US identify as Hmong alone. 89% increase. This is an 89% increase from the year 2000. So that's about 25 years ago. So it's up from 155,000, up from 155,000 to 175,000. And 31% of them are made up are considered immigrants. And so when we look at this Hmong population by age, look at where the majority of our population is, right? 7% are 75 years and over, or from 64 to 75 years. The largest population in the Hmong community right now is between the years 18 to 54. And then looking at the youth portion of it, from under 5 years old to 17 years old, is 38%. So the Hmong in Minnesota are very young, okay? When you look at 38% of the population are youth, we have to prepare for how do we support our youth today, especially knowing the social issues that our kids face every day. And how do we as community members prepare to support some of the work, some of the issues that they are facing, and we'll talk a little bit about that in a bit. If we look at the Hmong educational attainment, Americans is the darker gray, and Asian is the light blue, and Hmong is in the yellow, right? So if we look at less than a high school diploma, we have 45% of the population. Some college is 31. Bachelor degree is 17, and postgrad degree is 6%. So if we look at the overall statistics of how our community is looking, we want to be able to kind of like, how do we support our kids, especially at a younger age, so that we can prepare them for the future? Some mental health statistics, right? The mental illness prevalence. 33.5% of Hmong people are considered to have some sort of mental health disorder. And then the risk is 2 times higher for anxiety, depression, and PTSD versus the general population. And the Hmong youth in Minnesota are 4 to 5 times more likely than other youth to have suicidal thoughts. Compared with non-Hmong population in clinical settings, Hmong individuals are more likely to receive a PTSD diagnosis with an anxiety disorder. Approximately 71% of anxiety cases in Hmong were PTSD versus 18% in non-Hmong groups. And so when I look at the statistics, I think about all the kids that we serve in our program. And between the 7 schools that we have, and each clinician in our schools hold up to a case between 18 to 20 clients. And the majority of the diagnoses that we are seeing is anxiety, depression. And so I was really surprised with the research that showed that PTSD is also the highest. And this also tells me that we need to do more research around what the prevalence is. But from the current research that I was looking at, PTSD is rated the highest among the population. And why is that? It's due to trauma. We know that we come from a community of trauma after the war, and acculturation and adjustment has been difficult. And this was, so Wilder Research does a lot of evaluation with our kids and families. And one part of our program, we provide what we called rite of passage programming. And so that's when we teach kids about their history, their identity, and who they are as Hmong kids or as Hmong people. And so this is what one of the parents said. There is depression and trauma in our community. There's a shared war story of how the Hmong community even arrived and immigrated to the United States. And I think it's trying to bring those up and say this is part of our culture, part of our community. And by avoiding that, it's almost saying that it never existed. Again, the leading mental health diagnosis among Hmong youth is PTSD, depression, and anxiety. Some of the symptom expressions. And so this research was done by Wilder Research in 2010, and it's still very accurate today. As I was looking and I was thinking about this presentation, I'm like, let me look at more current research, and there's not a lot of current research out there. There is some, but not a lot. That's why I really appreciate Austin and Bania, who are continuing to do some of that work for us. And so what are somatic symptoms? So they are characterized by an extreme focus on physical symptoms such as pain, fatigue that causes major emotional distress, and problems functioning as a result of mental health perceptions, internalizing behaviors, shame, and stigma. So let me give you an example. So I recently opened up a case, and I don't usually see clients anymore because I'm doing a lot more supervising. But one of my colleagues said, you need to see this client. She is really struggling, and we need someone who really understands mental health and depression and how to work with her. And one of the first symptoms that she shared with me was that she was always having stomach pain. She had severe stomach pain. She would go to the hospital, and the doctor said, you don't have any issues, you're healthy. But she reports of having physical pain every night, every day, and it's constant and it's chronic. And I asked her, is it like an ulcer or is it, A, B, and C? And she just says, no, they didn't diagnose me with anything. They gave me pain medicine. It doesn't work. And so we started to talk about how her depression and her high anxiety has caused her to have these somatic symptoms, right? And when we acknowledged that, she said it makes sense because every time she is overly anxious, every time she's very depressed, that's when the pain comes. That's when the pain occurs. That's when the chest pain occurs, right? And so this is what they call somatic symptoms. And when you're working with somebody who's dealing with severe mental health symptoms, they may be sharing that these are some of the things that they're experiencing, especially when they are internalizing these mental health symptoms, right? So you will see this in more people who internalize their emotions. So that means that they keep everything inside, right? And so these are some things to look for. Passive behaviors. It involves saying nothing in response keeping feelings to themselves, hiding their feelings from others, and perhaps even hiding your feelings from yourself, right? And I saw this a lot in the children that I worked with when I started Luzon at Jackson. I like to share this story where when I walked into the school social worker and counselor said to me, "Our Hmong kids are fine. They're quiet, they listen to the teacher, they don't do anything. So I don't understand why we need your services." And I turned to my boss and the principal, I said, "What am I doing here? If this is the response from the adults in the schools about Hmong kids, I'm like, I'm fighting against a wall that is so high and thick that I don't know how I'm gonna tear it down, right?" And so I'm like, I don't think I'm gonna last a month, okay? I told my boss, I'm like, if this is the type of people that I'm having to work with, because it wasn't just the adults, it was also the parents. Our Hmong community was very resistant to even receiving mental health services for their own child. And so the work that we did about 15 years ago, and I just appreciate all the mental health workers that continue to do this work, because the stigma is still there. It hasn't gone away, okay? Even though people are more willing to acknowledge that there are mental health issues in their children, in the family systems, the stigma is still very much present. And so I decided to make a list of some mental health symptom expressions. And so I handed this out to all the teachers. I said, I need to do something to help them see and look for symptoms that would help me identify some Hmong kids in the school that would need supports. And so these are some of the symptoms that I listed. Overly shy, difficulty following directions, very soft-spoken, difficulty focusing, easily tearful, isolation or withdrawn, poor social skills, low self-esteem, low mood, social anxiety, low confidence, easily fearful, and self-harming behaviors or suicidality. Within a week, I received 35 referrals. Not to say that all these kids had severe mental health disorders, okay? But what it was saying was that teachers were starting to see that these kids are displaying some of these symptoms. And then it was my job to filter out who were the kids that really, really needed this, right? And so I started the program with a non-clinical group and a clinical group. And so I put everybody in non-clinical work that I did, so it was just more social skills group. And through that, I was able to identify the kids who had trauma, depression, and super high anxiety. And from there, we started to do assessments. And that was how we started to introduce our services to the school and to the families. And so I didn't quit after a month. Here I am almost 16 years later, still doing that work and leading clinicians and doing that work. So some of the contributing mental health factors for Hmong youth, I want us to think about. These are things to look out for. We know that this is happening in our community, social stressors, economic hardship and poverty, exposure to community violence, substance use and abuse, including drug trafficking and addiction. And I want to highlight the substance use and abuse. We see that this is very high in our community. I know that our community is very good at fellowshipping, getting together, supporting each other, but yet we also notice that there's a lot of alcohol that's involved, a lot of use and substance that are involved in this. And we need to know that our children are watching us. They see this and they're normalizing this behavior. And so when we see this increase in our community, we as adults need to be more mindful of how that is impacting us as a community and to our children and future generations. And so I wanted to highlight this because I see a lot of this in the work that we do with our kids. The parents are using. The kids are exploring this. As young as like 3rd, 4th grade, they're telling us that, they've tried alcohol or they've tried to because they see it. And so that, to me, is very concerning. And so how do we address that in our community? Family stressors. It includes intergenerational conflicts between parents and youth. We know that a lot of Hmong parents, they're speaking Hmong, but their kids don't understand, okay? That's half or more than half of our caseload. When it comes to a Hmong-speaking parent, but the child does not understand, and they're not even communicating. And we know that social media, we know that technology has also played a part in that, right? So parents are on their phones, kids are on their phones, and so there's this lack of communication even within the family system. And so when there's a lack of that, we think about these intergenerational conflicts are also playing a role in how these relationships are being built within the family system. We have shifting in traditional gender roles and expectations, family instability, increased divorce rates. This is a big one too. I was asking my staff the other day, I'm like, how many kids on your caseload come from a blended family or a single parent home? And it's more than almost like 70%. It's very high, so we want to look at, there's a lot of brokenness in our own communities in the family systems. Domestic violence and emotional neglect. And then youth stressors, acculturation challenges and identity confusion, and pressure from social media and online environments. So some of the gaps that we still experience right now is lack of bilingual and bicultural Hmong providers, lack of culturally competent services, which includes language and cultural knowledge, and lack of early prevention and intervention services like parenting, education, and school-based mental health services.